So yeah, hello everyone, good afternoon. So yeah, let's begin with the MCQs. And the first one is, what is the visible range of electromagnetic spectrum of the human eye? I repeat, what is the visible range of electromagnetic spectrum of the human eye? And yeah, and the options here are, the options here are 200 to 370. Okay, I'll just repeat the question once. The question is, what is the visible range of electromagnetic spectrum of the human eye? And the options are 200 to 370, 370 to 740, 740 to 1140, or it's 800 to 900. So yeah, hello. So yeah, the question was, what is the visible range of electromagnetic spectrum of a human eye? And anyone wants to answer this, it's 200 to 370, 370 to 740, and 740 to 1140, and the last one is 800 to 900. So yeah, what is the visible range? So yeah, the answer here is, the answer is, you have to remember this, it's 370 to 740 is the electromagnetic spectrum range for a human eye. So yeah, the next question we have is a 30-year-old, it's a OBG question here. So yeah, it's a OBG, it's a 30-year-old woman with dyspareunia, and she is diagnosed to have endometriosis. So which of the following drugs is not useful for the treatment? And the options are estrogen, progesterone, danazol, and it's a GnRH. So yeah, basically you have to know what is endometriosis, and endometriosis is basically it's endometrium outside the uterus. Anywhere outside the uterus you have an endometrium which will cause symptoms, it's called as endometriosis. So yeah, here it is a patient with 30-year-old dyspareunia and endometriosis. So which of the following drugs you will not give for this condition? So estrogen, progesterone, danazol, or it's a GnRH. Okay. Why, what happened? Okay, I will only tell. Its answer here is A. A is the right answer, estrogen. So yeah, estrogen, progesterone, danazol, or GnRH. And the option here is A, that is the estrogen. Why estrogen? See, progesterone, danazol, and GnRH we can give in endometriosis. But yeah, why not estrogen? Anyone? Okay, I will only tell. It's basically, see, estrogen, it's endometriosis basically estrogen dependent. So it's estrogen dependent. If you give estrogen, it will cause more and more production of endometrium. Production in that lining of the endometrium, it will cause bleeding. So yeah, we don't give estrogen. Progesterone, it's basically progesterone, danazol, and GnRH. And the drug of choice is GnRH here, because if you give GnRH from outside, your brain will think that your body already has GnRH, so it will not produce estrogen and progesterone, mainly estrogen. So yeah, that's why. So yeah, it's a estrogen induced condition, that's why we don't give. That is estrogen dependent condition. So yeah. Next we have, it's a peak expiratory flow rate, that is PEFR. Values of a group of a 11-year-old girl has a mean of 300 liter per minute, and the standard deviation is 20 I per minute. So yeah, it's a PSM question. And what are the deviation score for the PEFR values of two girls recorded at 280 and 330 respectively? So yeah, see, it's a PSM. I also don't know what's the formula for this. And the options are minus 20 and minus 20 and 30, 20 and 30, 20 and minus 30, and it's a minus 20 and minus 30. So yeah, anyone? If you know the formula, it's a PEFR, and the values is 300 liter per minute, standard deviation is 20 liter per minute, and it's a case of 11-year-old. And the deviation score for PEFR values of two girls recorded at 280 liter per minute and 330 liter per minute. So yeah, see, it's a PSM question. I also don't know this. It's okay, yeah, the deviation score of PEFR values, and whatever the answer is, okay, answer is A, that is minus 20 and minus 30. But yeah, the deviation score of an element in a distribution is the difference between the mean and distribution and the element itself. That is, it is obtained by subtracting the distribution mean from the element. Yeah, okay, that is, here it will be, it's 280 minus 300, that is minus 20. So it's very difficult, I don't think. And the value 330 liter per minute, that is deviation score is 330 minus 300, that is 30. So yeah, there is a formula here. You have to apply the deviation score here. Hello. So we have to apply the deviation score here. So we'll move on to the next question. It's PSM. It's okay. Next question we have, it's a 28-year-old man presents to the dermatology OPD and with the complaints of patchy hair loss. So a punch biopsy you take from the scalp and to basically know what is the cause of hair loss, and given below is the histological section of the hair follicle. Identify the such a mark Y in the image. So yeah, I can just tell you what the image here, but not to tell you. Basically they have given it's a full histology of hair. So in a histology of hair, what should I say? I don't know. It's a image. If the image is there with you, then only can answer. So yeah, the image is basically outer root sheet. It's a part of the. I cannot tell in this. It's a okay. I'll just tell what is the layers of the hair follicle, and it's the outer root sheet. That is the inner root and the hair shaft, and it's a dermal hair papilla. So yeah, just remember what are the layers of the hair. So yeah, it's the outer root sheet, and in inner root we have two things, that is the hustless layer and hairless layer. Whereas in the hair shaft we have the cuticle, cortex and medulla, as you know, and the last one is the dermal hair papilla. So they are the layers of the hair follicle. So yeah, next we move on to the question. It is the easy one. What is the most common malignancy in the GI tract? Gastric adenocarcinoma, gastrointestinal stromal tumor, adenocarcinoma colon, or it's a carcinoma tumor of appendix. Yep, this you can tell. Anyone? What is the most common malignancy of GI tract? That is GIT. Gastric adenocarcinoma, gastrointestinal stromal tumor, adenocarcinoma colon, or it's a carcinoma tumor of appendix. So yeah, I want this answer if you can guess at least A, B, C, D. Anyone? Okay, I will tell it's okay, no one wants, I think. Okay, the answer is C, that is it's adenocarcinoma of colon is the most common, that is a carcinoma in the GIT, malignancy in the GIT. So yeah, that's all you have to remember, that only. Yeah, there is a right and left, it's a carcinoma of distal colon, tends to be annular lesions that produces napkin gene constriction and luminal narrowing. So yeah. Okay, the most common actually adenocarcinoma. So yeah, next we have which of the following statements most appropriately describe the vasomotor reversal of DALE. So and the options are stimulation of alpha 1 followed by stimulation of beta 2, blockage of alpha 1 followed by stimulation of beta 2, or it's a stimulation of alpha 1 followed by blockage of beta 2, and last one is stimulation of beta 1 followed by blockage of beta 2. So yeah, it's basically they are asking about the vasomotor reversal of DALE. If you can tell, most appropriately describe the vasomotor reversal of DALE. So yeah, anyone? It's basically it's a pharma question. Yeah. Okay, I will tell it's the answer. You see in vasomotor reversal of DALE, it will be blockage of the alpha followed by it will be stimulation of the beta. I'll just tell what they have written here because I also don't know this one. It's normally a high dose of epinephrine injected produces the alpha mediated rise in BP followed by beta mediated fall in BP, that we know. So if you give epinephrine, there will be alpha mediated rise in BP, then we have a beta 2 mediated fall in BP. So administration of epinephrine after administration of alpha blocker produces only a fall in BP. So this is because the alpha mediated response is abolished and hence only the beta mediated response is seen, resulting in the fall in BP. This phenomenon is called vasomotor reversal of DALE. Okay. I know this phenomenon, but yeah, it's known as vasomotor reversal of DALE. So yeah, next we move on to the next question. It's a chest X-ray of an emphysematous patient is shown that they have given. So what is the best investigation to measure the lung volume? So yeah, okay, I'll just tell what is there in the. Okay, yeah, it's a emphysematous. It's a emphysematous X-ray, and in emphysema, there will be bullous lesion will be there. So yeah, just tell me what is the best investigation to measure lung volume in a patient with emphysematous patient here only. So yeah, the options are body plethysmography, gas dilution, fractional SZ-NO, or it's a DLCO. Anyone? Body plethysmography, gas dilution, fractional SZ-NO, or it's a DLCO. Anyone wants to answer this? To measure lung volume in emphysematous patient, what is the investigation of choice? Okay, I will tell the answer here is A, that is it's a body plethysmography, which is the investigation of choice in a condition with emphysematous patient, because in emphysema there are bullous lesions, and you also want to know the basically that only A. So yeah, you also want to know the basically the what the content of the emphy, that is the bullous lesion also. So in that case, it's a body plethysmography is the investigation of choice. So yeah, next we move on. In which of the following patients is the administration of barbiturates contraindicated? Options are, this one is the easy one, I think you can tell. Which of the following patients is the administration of the barbiturates contraindicated? Options are in a 29-year-old lady with a history of anxiety disorder. Then we have a 33-year-old man with a history of acute intermittent porphyria. Then 50-year-old man refractory status epilepticus, or it's a 11-day neonate with connectors. Anyone wants to answer this? Which of the following patient is where barbiturates contraindicated in which of the following condition? 29-year-old anxiety disorder, 33-year-old acute intermittent porphyria, or it's a 50-year-old refractory status epilepticus. And last one is 11-day neonate with connectors. Anyone? When are barbiturates contraindicated? Anyone wants to answer this? Okay, I will only tell. See, yeah, D. See, D. No. Connectors. No. We have barbiturates. We use in connectors. Yeah. Phenobarbital we use in connectors. So yeah, connectors is not the right answer. See, phenobarbital can be used to treat connectors in newborns as it increases hepatic glucose, that is a UGT enzyme activity and conjugation of bilirubin. So yeah, no, it's not D. The answer here is B. That is a 33-year-old man with acute intermittent porphyria. So it's a contraindicated here. So yeah, because basically it's barbiturates are enzyme inducers, and if you have any enzyme inducer, it will result in increased synthesis of porphyrias, that is porphyrins, and subsequent precipitation of porphyria. So yeah, the answer here is B. That is the acute intermittent porphyria is contraindicated in a patient with that is for the administration of barbiturates. So yeah. Next we have which of the following values of biochemical oxygen demand would indicate the sewage is weak? It's a PSM question. I will just repeat. Which of the following values of biochemical oxygen demand would indicate that the sewage is weak? Options are 100 mg per liter, 500 mg, 300 mg, or 250 mg per liter. So you can just guess what is the answer. Biochemical oxygen demand would indicate that the sewage is weak. Anyone? It's a factual question. You have to know the values here only. Okay, I will only tell its answer is A. That is 100 mg per liter is the basically the biochemical oxygen demand. You can tell when it is the sewage is weak. So when you tell the sewage is strong, it is that is greater than 300 mg per liter. You can tell that the sewage is strong. So yeah, that is a BOT. That is a standard test, which is an indicator of the organic content of sewage. So yeah, next we have effective vibratory area of the tympanic membrane is much larger than the area of Stapes footplate. So which of the following is most accurate value of the average ratio between the two? And the options here are 17:1, 1.3:1, 18:1, or is 22:1. So yeah, it's a ENT question here. I'll just repeat. You have a effective vibratory area of the tympanic membrane is much larger than the area of the Stapes, as you all know, Stapes footplate. So which of the following is the most accurate value of average between the two? 17:1, 1.3:1, 18:1, or it's 22:1. Yeah, if you can just guess it out. You know you have learned in ENT. If you know, then okay. So I will only tell its answer is okay. The answer is 17:1. Why? There is no reason for why, but yeah, it's tympanic membrane area is more. That is 17:1 is that is the Stapes footplate. So yeah, 17:1 is the area you have to remember. Areal ratio you can tell. Effective vibratory area of tympanic membrane by Stapes footplate area. A is the right answer. Next we have find the incorrect match. That is next options are raphe nucleus, that is serotonin, locus coeruleus norepinephrine, basal forebrain complex, that is GABA, or it's a histamine hypothalamus. Anyone wants to answer? It's incorrect match. Which is the wrong basically? I'll just repeat. It's raphe nucleus, that is serotonin, locus coeruleus norepinephrine, basal forebrain complex GABA, or it's a histamine hypothalamus. So yeah, anyone? Which is the wrong answer here? See base. Okay, I will only tell. The answer is C. That is the basal forebrain complex. They have given basal forebrain complex as GABA, but no, GABA it is not. It is not GABA. It's basically acetylcholine, which is rich in basal forebrain complex. Another like Raphe it is rich in serotonin. Lucus coeruleus, it is rich in non-epinephrine and histamine. Yeah, C is the right answer. And the histamine is rich in hypothalamus. No, the hypothalamus is rich in histamine. Okay, next we have it's a 60-year-old man who presents to you with bone pain, weakness, and loss of weight for 3 years. So on examination, enlarged lymph nodes and organomegaly was noted. So now we do a peripheral smear. In peripheral smear, it shows 22% plasma cells, so which are delta chain restricted, and serum Ig levels are elevated. So X-ray image of the lumbar vertebra shows a lighted punch out lesion. So yeah, if you have a lighted punch out lesion, you can just tell the diagnosis. They're asking the diagnosis only here. So I'll just repeat if you want. It's a 60-year-old, bone pain, weakness, loss of weight for the last 3 years. Examination, you have enlarged lymph nodes, organomegaly. Peripheral smear shows 22% plasma cells with a delta chain restricted, Ig level elevated, and the lumbar vertebra has punch out lesions. So what is the diagnosis? Multiple myeloma, plasmacytoma, lymphoblastic lymphoma, or it's a plasma cell leukemia. Anyone? It's an easy one. So I'll just repeat, it's a multiple myeloma, plasmacytoma, lymphoplasmacytic lymphoma, or it's a plasma cell leukemia. Anyone if you want to answer? See, you have peripheral smear more than 22% plasma cells. So yeah, then you can just tell what is the answer here. See, organomegaly is there, elevated Ig levels are there. Multiple myeloma, no. Multiple myeloma plasma cells will be high. I don't know. See, that way multiple basically in the urine it will be high. So yeah, the answer here is D, right? It is a plasma cell leukemia. See, if you have a organomegaly and enlarged means that is a lymphedema is there. That is lymphadenopathy is there. So if you have a lymphadenopathy, so you will have that is you will consider it's a leukemia. No, it's a D, plasma cell leukemia. So if there is a lymphedema, that is lymphadenopathy, you consider it as a leukemia. Generally, I'm telling. So yeah, and plasma cells are high. So here will be plasma cell leukemia is the right answer. That is D is the right answer. Next we have a woman is there. A woman with irregular periods was evaluated for infertility and underwent an endometrial biopsy. So there is a histological image which has been given below. I will just say what is the image here. And the image is it's a endometrium. They have given an endometrium and a proliferate. Okay, I just said the answer. Or they have given the endometrium. You cannot tell which will what is the answer without seeing the image. So yeah, the answer is that only. I'll just repeat the question and then the answer only. A woman is there with irregular periods and she was evaluated for infertility, and then she underwent an endometrial biopsy. So histological image is what? So yeah, the answer I told, it's a proliferative phase only. They are showing us. So yeah, we know the stages of endometrium. It's a proliferative, secretory, and the last one is menstrual. That is menstruation, menstrual phase. So yeah, in proliferative, what you can see is what they have shown is that glands of the functional layer are simple tubules with irregular epithelium. Arteries may be coiled or spiral, and endometrium is thick. The stroma is compact, and the short straight glands are present. So yeah, we will move on to the next question. Next, we have a man who is frustrated because of his wife's decreased sexual activity, that is sexual desire. So she was recently diagnosed with depression and started on a drug for the same. So which of the following drugs was mostly likely prescribed? Options are fluoxetine, mirtazapine, and bupropion or trazodone. So I'll repeat: a man feels that man is frustrated because his wife has a decreased sexual desire. So she was recently diagnosed with depression and started on a drug for the same. So which of the following drug was mostly likely to be prescribed here? It's a fluoxetine, mirtazapine, bupropion, or trazodone. Anyone? Yeah, A is the right answer. See, fluoxetine we use, that is SSRI. It's not SSRI. It's SSRI only. Yeah, SSRI we use that is because of it's a okay. She was already started on a drug. Okay. Yeah, fluoxetine is the right answer because the fluoxetine has a side effect, that is it's a sexual dysfunction. So fluoxetine will cause a sexual dysfunction. So yeah, it's a side effect of fluoxetine in this condition. So yeah. So fluoxetine will cause nausea, anorexia, loss of libido, or insomnia it will cause. So right answer is A. Next we have, it's a calculation question. I will just tell. It's in a reaction. It's a biochemistry, if you can tell this. In a reaction, the substrate is available in a concentration that is 1000 times the Km value of the enzyme. After 9 minutes of the reaction, 1% of substrate is converted to product, that is 12 microgram per ml. If the concentration of the enzyme is changed to 1/3 and the concentration of the substrate is doubled, what is the time taken to convert the substrate into the same amount of product, that is 12 microgram per ml? 9 minutes, 4.5 minutes, 27 minutes, or it's 13.5 minutes. So yeah, which order kinetics it is. See, the Km value they have given here is, that is what to tell here basically. Okay, when the substance concentration is much greater than the Km value, the rate of reaction is independent of the substrate concentration, that is it follows the zero order kinetics. So yeah, if it follows the zero order kinetics, the answer will be, that is in 9 minutes 1% is converted to the product. So in 9 minutes it is basically 12 microgram. So it basically, and 1/3 of the concentration of enzyme is changed to 1/3. So yeah, basically it will be 9 into 3, that is 27 is the right answer here. It follows the zero order kinetics. So if it follows the zero order kinetics, it is a minimum value which it will be exceeded in every time. So after 9 minutes, 1% is converted to the product, that is 12 microgram. So yeah, so and 1/3 of the concentration and the concentration of substrate is doubled. So yeah, it's 9 into 3, that is, we can tell 27 minutes here. Next we move on to a woman found out that her husband is having a consensual sexual relationship with another man, and that the affair has been going on for a few months. So she was deeply aggrieved and committed suicide. Upon investigation, the police found a suicide note wherein she had stated all the facts. Under which of the following section can the husband be booked? Basically, we have discussed this yesterday only, I think. Not yesterday, before only. See, same question was there, that there was a woman who found that her husband is having consensual sexual relationship with another man, and that the affair was going on for a few months, and she committed suicide. Upon investigation, the police found a suicide note wherein she stated that all the facts. So under which IPC the husband will be booked? IPC 497, 377, 306, or none of the above? Anyone? IPC 497, 377, or 306 of the IPC, or none of the above? Okay, basically it's a case of abatement to suicide, and in abatement to suicide, its IPC is 306. You have to remember here. So IPC 306 is the right answer. It is abatement to suicide. As per the Honorable Supreme Court on 2018, is stated that if any aggrieved spouse commits suicide because of the life partner's relation, if evidence produced, it could be treated as abatement to suicide. So it's a IPC 306. Next question we have, which of the following is a correct statement regarding retroperitoneal trauma? And the options are: all zone 1 injury to be treated conservatively, zone 3 injury, whether blunt or penetrative, should always be excluded. Then we have zone 3 injury with expanding hematoma, should be treated surgically. And the last one is Mattox maneuver, is when the ascending colon is mobilized to the right to visualize the aorta. So yeah, I know it's a long question here, but yeah, which of the following is correct regarding the retroperitoneal trauma? I will not repeat the question, it's a long question. If anyone has heard already, I'll just tell it. Okay, I'll just tell again. It's all zone 1 injury to be treated conservatively. All zone 3 injury, whether blunt or penetrative, should always be explored. If there is a zone 2 injury with expanding hematoma, should be treated surgically. And the last one is Mattox maneuver, is when the ascending colon is mobilized to right to visualize the aorta. So which one is the correct answer here? Yeah, it's okay. I'll just repeat the question. Question which of the following is a correct statement regarding the retroperitoneal trauma? And the option, see, in a retroperitoneal trauma we have zone 1, zone 2, and zone 3. So they are basically asking which is the correct one regarding that. So option 1 is all zone 1 injury to be treated conservatively. Second one is zone 3 injury, whether blunt or penetrative, should always be explored. Zone 2 injury with expanding hematoma should be treated surgically. And the last one is Mattock's maneuver, is when the ascending colon is mobilized to the right to visualize the aorta. So if you know all the zones, then only you can answer. Yeah, it is divided into 3 zones, what I told, and differential management in brain trauma. Okay, I'll just tell the answer. The answer here is that is C, that is a zone 2 injury with a expanding hematoma should be treated surgically. See, it says, yeah. See, there are 3 zones as I said, zone 1, 2 and 3. So in zone 1, basically it is always explode, you have to remember. B. Yes, no, it's C is the right answer. Because see, zone 3 you just said, zone 3 was, option B was, that is zone 3 injury whether blunt or penetrative should always be explode. So no, because in zone 3, only it is explored if the hematoma is pulsatile or expanding, else conservative treatment you will give. So yeah, so if it is only, it's a pulsatile, hematoma is pulsatile or expanding, then only we will do a surgery, otherwise we won't. So the answer was zone 2. So if there is it is also only explored if the hematoma is pulsatile or expanding, else conservative. Same, zone 2 and zone 3 we give the same treatment, and for zone 1 it is like always explored. After proximal distal vascular control, we will always explore the zone 1. So yeah. Next question we will go through. In a patient undergoing testing for SARS-CoV-2, that is the COVID basically, Feluda test is done. So which of the following statement is false about this technology? So it's a big one. Okay, I'll just repeat. It's in a patient who is undergoing COVID test, that is a Feluda test, FELUDA. Feluda test is done. So which of the following statement is false about this condition? So the options are, it is the acronym for FNCA S9 Retail Link Uniform Detection Assay. Second option is, it is based on CRISPR, that is CRISPR gene editing technology. And the third one is, it is slower than RT-PCR in detecting COVID. And the fourth one is, it uses CS9 protein to bind to the viral signature. I will repeat, it's a Feluda test, and what is the statement is false. First, it's an acronym for FNCA S9 Retail Link Uniform Detection Assay. Second was, it was based on CRISPR gene technology. Third was, it is slower than RT-PCR in detecting the COVID. And the fourth was, it uses CS9 protein to bind to the viral signature. So yeah. Okay. Anyone? Okay, the answer here is, it's C. C is the right answer. C is the right answer. That is C, Feluda test. Feluda is what, FELUDA if you can tell. Feluda test is basically, it's the answer which was the false. So yeah, the answer here is Feluda test is faster than RT-PCR. That is, it's a right. Feluda test is faster than RT-PCR for detecting COVID. And other what was, it was other way right only, it is that. So yeah. So I'll just tell what is the Feluda test. Feluda test is basically, it is the acronym for FNCA S9 Retail Link Uniform Detection Assay. It is based on CRISPR gene editing technology. It is faster than RT-PCR for COVID-19. And then we have, it uses CS protein to bind to the viral signature. Next we move on to the question. It's an 11-year-old boy is brought with complaints of itchy lesions on his face for 5 days. So on examination, multiple ruptured blisters with honey-colored rusting are seen. So what is the most likely diagnosis? It's a bullous impetigo, erythema, non-bullous impetigo, or it's a erysipelas. I repeat the question. The question is, an 11-year-old boy who presents with complaints of itchy lesions on his face for 5 days. So on examination, multiple ruptured blisters with honey-colored rusting are seen. So what is the most likely diagnosis here? And the options are bullous impetigo, erythema, non-bullous impetigo, or erysipelas. Anyone wants to answer this? It's only one is there now, I think. Yeah. Okay, it's a case of it's a case of non-bullous impetigo. Why it's a case of non-bullous impetigo? Because see, you have itchy lesions on the face for that you leave it. You have itchy lesions, then you have a multiple ruptured blisters with honey color. See, honey color clustering you have, that means it's a case of non-bullous impetigo. Okay, it starts as very flaccid blisters which soon rupture, creating erosions that are covered with characteristic golden yellow or honey colored thrust. So you have whenever you think about a honey colored thrust, you have to think it's a non-bolus impetigo. Next we move on, then we have you are planning to wean a patient of mechanical ventilation. That is you are trying to remove the patient from mechanical ventilation. So which of the following is not a criteria to do so? So when will you not do it? So the options are tidal volume of 5 ml per kg, vital capacity of 5 ml per kg, minute ventilation of 10 liter per minute, it's the last one is inspiratory pressure of minus 25 centimeter H2O. So which of the following is not a criteria to wean off the patient from mechanical ventilation? So I repeat, it's a tidal volume of 5 ml per kg, vital capacity of 5 ml per kg, minute ventilation of 10 liter per kg, or it's an inspiratory pressure of minus 25 centimeter H2O. So yeah, if you can remember this. Okay, I'll just tell what are the criteria for weaning off. First one is there should be inspiratory pressure should be minus 20 to minus 30, and then tidal volume 4 to 6 ml, vital capacity should be greater than 10 ml per kg, and minute ventilation which we are talking about, it's be greater than 10 liter per minute, and rapid shallow breathing less than 100 should be present. Next we move on, it's a question with the truck driver undergoes Limburg flap operation using a random flap for recurrent pylonodal sinus infection. So what is the generally accepted safe and reliable length is to width ratio for this type of flap? 3:1, 2:1, 1:1.5:1, or 2.5:1? Anyone wants to answer? So it's a case of a Limburg flap operation using a random flap for recurrent pylonodal sinus infection. What is the generally accepted safe and reliable length is to width ratio? Okay, I will tell it's 1.5 is the one is the right answer here. So it is the reliable length is to width ratio for this condition. So next we move on, match the following developmental milestones. So I'll just tell the correct answer, but I don't tell the matching and all that. So yeah, the correct answer here is if it is transfers the object, it's 6 to 7 months. Then we have social smile is 1 to 2 months. Yeah, social smile comes very early, so it's 1 to 2 months. Principal graph is 9 to 12 months, that is the 1 year you can tell. And watch 1 to 2 steps is 12 to 15 months. So I'll just repeat, it's transfer object is 6 to 7, social smile is 1 to 2 months. Then we have a principal graph that is 9 to 12 months, and last we have the watch with watch 1 to 2 steps, it's 12 to 15 months here. So yeah, let's move on to the next question. The question is, which among the following is not a feature of joint pain seen in the patient with rheumatic fever? So I repeat, which among the following is not a feature of joint pain seen in patient with rheumatic fever? And the options are migratory arthritis, it mainly involves large joint, symmetric involvement, and good response to salicylates. So not a feature of joint pain. So in rheumatic arthritis, it's a symmetry. So yeah, symmetrical involvement won't be there. Then migratory arthritis, you can see good response to salicylates, you can see that. But yeah, it's mainly involves large joints. It's not basically it involves the upper joints. It's a case of rheumatic fever. Yeah, it's rheumatic fever. So yeah. Okay, I heard it's a rheumatic arthritis, and it's case of rheumatic fever. So yeah, it's symmetrical involvement will not be seen here. It's a asymmetrical involvement, and migratory pain will be there, and it involves large joints, and it is highly responsive to the salicylates. So it will be asymmetrical involvement in case of rheumatic fever. Next we move on, last two questions we have. That is the question is, which of the following classification is not used for neck of femur fracture? And the options are Powell's classification, Garden classification, Dalbert classification, and the last is Needs classification. So which of the following we don't use for? Yeah, hello. So yeah, the question was which of the following we don't use for neck of femur fractures, and the options I told, it's a Powell's, Gardens, Delbert's, or it's Needs classification. So yeah, if you can tell the answer here, which we don't use. Okay, I will only tell the answer here. If you don't know the answer here is basically it's a D, that is Needs classification. See, Needs classification we use for proximal humerus fracture and not for neck of femur fracture. Proximal humerus fracture only we use Needs classification. Others we know Powell's, Gardens, and Delbert we use for neck of femur. No, Delbert also we use. So yeah, the Delbet is used in in children. We use Delbet. We use in children basically. So yeah, the option it's a D is the right answer. That is a knee classification that we use in proximal humerus fracture. Next, that is the last question for today. We have, what was the first isotope used for radiotherapy? Radium-226, Iridium-192, Caesium-137, or it's Iodine-131. So yeah, the last question, if you can just guess what is the answer. So first isotope used for radiotherapy is Radium-226, Iridium-192, Cesium-137, or it's Iodine-131. So yeah, the last question I just told. First isotope used for radiotherapy. Anyone? Radium-226, Iridium-192, Cesium-137, or it's Iodine-131. Okay, I'll just tell the answer here. It's if you don't want to guess, the answer is A. That is the Radium-226 is the right answer here, and that is used for the first time it was used for radiotherapy. So yeah, we are completed with all the MCQs. So yeah, thank you so much for joining.